Getting atrial fibrillation is not a death sentence. There are ways to control it, and there are ways to improve your quality of life even if you have atrial fibrillation. Hi, I'm Ching Chi Keong, heart rhythm cardiologist at National Heart Centre, Singapore. Within the heart is an electrical system. It exists so that the heart pumps in a coordinated manner, a little slower when you're at rest, and a little faster when you need to climb the steps. Now, atrial fibrillation is a condition that affects the electrical system of the heart. It is the most common abnormal heart rhythm and affects millions worldwide. The lifetime risk of atrial fibrillation is about 1 in 3%. The main complications of atrial fibrillation is 1, strokes. The upper chambers are not pumping effectively. The blood flow is sluggish. Clot may form. If it gets dislodged and goes to the brain, it causes a stroke. A person with AFib has 5 times risk of getting strokes compared to one without. Second would be the risk of getting heart failure. If the heart rate or the heart pumps too fast or too long, it may weaken the heart. Thirdly, it affects quality of life. Patients become symptomatic and they go to the hospital or clinic in an unscheduled manner for treatment. For someone who is 50 years and younger, the chance is way less than 1%. But as we age to more than 80 years old, the chance increases to 1 in 10. The risk is also higher in those with high blood pressure, diabetes, history of heart attack, heart failure, heart valve issues, if they have lung disorders, thyroid disorders, or sleep disorders. Excessive caffeine or alcohol ingestion may also increase the risk of atrial fibrillation. Most patients will have unexplained palpitations described as rapid and irregular heart rate that is inappropriate for that situation. Together with that, they may feel breathless or they tire much easier. Some may have fainting or giddy spells. The most reliable way to diagnose atrial fibrillation is to do a ECG, what we call an electrocardiogram. It records the electrical signals of the heart, and on that graph, we are able to confirm the diagnosis of atrial fibrillation if the patient goes into atrial fibrillation while it is recorded. Having said that, the struggle or challenge would be for those with transient atrial fibrillation. They may have symptoms, but when they arrive at the clinic and when the ECG is done, it records a normal rhythm because they have gone back to normal rhythm. Hence, to catch these episodes effectively, we recommend patients get themselves wearable ECG gadget. Examples would be ECG watches or portable gadgets that record ECG. With that recorded ECG strip, you may show a doctor, and doctor is able to diagnose if that was an episode of atrial fibrillation. Treating atrial fibrillation is as easy as ABC. A, avoid strokes. See a doctor, he will assess your risk of getting stroke. If the risk is high, the doctor will usually prescribe anticoagulants. This medication reduces the chance of blood clot formation within the heart chambers. There are many types of drugs available, such as warfarin that was used for many decades. But there are newer drugs. It's easier to use with less drug interaction, such as apixaban, dabigatran, edoxaban, and rivaroxaban. You should talk to your doctor whether you are a suitable candidate for such drugs to reduce the risk of strokes. B would be for better symptom control. We give medication to control the heart rate when the individual is in atrial fibrillation. We may also give medication to restore normal rhythm. Alternatively, there are minimally invasive procedures to restore normal rhythm, such as cardioversion, which is an electrical shock to the heart, or Other procedures such as catheter ablation. Catheter ablation is a minimally invasive procedure where catheters are placed into the upper chambers of the heart, and the objective is to dissolve or ablate the atrial tissues of its electrical properties and hence remove the electrical triggers that start and maintain atrial fibrillation. C is for cardiovascular risk factor management, is to treat existing heart disorders to reduce triggers and maintenance of atrial fibrillation, also to treat existing health conditions such as hypertension, diabetes. Of note, a healthy, active lifestyle is important, as is good dietary habits. Lastly, please take the medication prescribed by your doctor and have your condition assessed on a regular basis. Treatment of atrial fibrillation is as easy as ABC. See a doctor, take the medication regularly, maintain a healthy lifestyle, maintain a healthy eating habit.